Patrick Commiskey in Albuquerque, New Mexico. This is a patient who was referred in for development of blurry vision about a year and a half after cataract surgery. This is the left eye, and the patient noticed that after the surgery things looked really good, and then about 18 months later rubbed the eye, and then things became blurry. She had vitreous in the anterior chamber right in the front of the pupil. So here we're just using anterior vitrectomy to remove the vitreous, the gel from the back of the eye, remove it from the front part of the eye. So I've removed it from the front part, and then there I'm just slipping behind the lens in the area of that capsule defect and remove the vitreous from immediately behind the lens as well. We're prepared to exchange this lens if need be, and you do notice that the lens is a little bit decentered. However, the patient noticed that her vision was quite good immediately after the surgery. So even though the lens is a little bit decentered, and it looks like a DI Boo, the J&J Eyhance lens, um, she's happy with that quality of vision that she had shortly after the surgery. So the lens is quite stable in the capsular bag, despite that small opening. And when I kind of pressure tested it, the the lens was not moving. So um, this seemed like a good and straightforward solution. Sometimes less is more. Just get rid of the vitreous um, and seal up the incision. And the patient really did quite well. This took care of her issue, and we haven't had to see her back. The end of the surgery, we're just sealing up the wounds. I used some Myocol, which brought down the pupil and helped to verify that there's no remaining vitreous. Thanks for watching.